Good morning, everybody. So, how's the Josh? So, ये सब जो आपने पिछले वाली स्लाइड पे पढ़ा ना, that is not important to me. What is important to me is that I like to teach. I've been a teacher for more than 35 years. I entered med school in 1975. So, obviously, you were not born at that time. I became a teacher in 1985. As soon as I finished my MD, I got selected in the RPSC as assistant professor. उस टाइम पे lecturers होते थे medicine, and I've been a teacher since 1985. And when your coordinators, Dr. Aparna and Dr. Prabhu, told me that can you take this class, I did not even have 1 minute's hesitation. I said yes, I will take this class. Okay, so I know that it's tough for you to continuously sit and listen to somebody for 2 hours, 1 hour, but I'll try to make it as interesting as possible. Secondly, जो भी बात करेगा, जैसे वो जेंटलमैन मिडिल वाले ब्लॉक में 4th 5th रो में बात कर रहे हैं, सबसे पहले मैं आपसे क्वेश्चन पूछूंगा, ठीक है? बाकी सबसे भी पूछूंगा, बट सबसे पहले आपसे पूछूंगा, ठीक है? ओके, सो ध्यान से सुनना. So I'm going to, a little bit of what options you have after you finish your MBBS has already been talked to you in the earlier lecture by Dr. Goyanka. I'll see if I can expand on that. And I'll be very happy if it is more interactive. If you have any questions, queries, comments, then we can sort it out right here. And I have no problem if you raise your hand or stand up and introduce and interrupt me in the middle. I'm still happy with that. Very much would want some interaction from you. Okay, so let's start. And why are we doing this? Because this is a mandate from the NMC. And then why am I doing it? Because I am passionate about teaching, and because I would very much want you guys, you people, you girls and boys, to really succeed in your career. So thank you very much for being here. Appreciate your presence here, whether voluntary or involuntary. And welcome to the Mahatma Gandhi Medical College Hospital. अच्छा, एक बात मेरी ध्यान रखना, whether you like this institution or you don't like this institution, whether you like your colleagues or you don't like your colleagues, whether you like your teachers or you don't like your teachers, but you will be a product of Mahatma Gandhi Medical College. And my suggestion to you is that have some pride in your institution. You may finish your undergraduation MBBS here and then go on to do your post-graduation somewhere else. You may do your post-graduation in this institution. You may have a 5-year association with this institution. You may have a 10-year association, but be proud of the institution. And make friends, make contacts. जो MBBS में दोस्त बनते हैं, and I can tell you from my experience, those are the best and the fastest friends you have, and they are your fallback in times of hardship. If you have a medical issue, if there is a family problem, when you have children, if there are some issues with the children, the first port of call is your friends. So make solid friendships and make as many friends as you can. And please remember, be proud of your institution. This is the institution which is going to lay the foundation of your medical career. So be proud of this institution. Whenever you talk about this institution, there are lots of good things about this institution, lots of not so good things also, but remember the good things and have some pride in your institution. So I want you to read this, and I want you to read this slowly. This particular line which you see can be read in 2 ways. One can be God is nowhere, and the other way to read this line is God is now here. So perspective is everything. You may be scolded by your teacher. You may feel extremely bad. I didn't do anything. Why was I scolded? But there is another perspective to it that is for your improvement. So always remember there are 2 ways of looking at a situation, 2 ways of reading a sentence, 2 ways of reacting to a situation. and there is always a positive way of reacting to a situation. Okay, so just remember that. And boys and girls, please remember that you are in a sunrise industry. Let nobody tell you, let nobody convince you that you have chosen wrong by getting into the medical field. You have a field which is on the uprise and which is going to remain uprise in your generation and in the next generation. I can practically guarantee that. Every other industry, there is a recession. अपने इंडस्ट्री में, अपनी फील्ड में, मेडिसिन में देयर इज नो रिसेशन. अभी कोविड टाइम में क्या हुआ था? यू विल रिमेंबर दैट यू वर नॉट इन द मेडिकल फील्ड एट दैट टाइम. Industries right and left were shutting down, and we were at the top. Everybody was coming to us, and that is the situation which is going to happen in the next 10 years, 20 years, 50 years. So rest assured that you have chosen well, and on the path which you have chosen, and learn to excel in that path. There are several options for you which we will just talk in the next few minutes. Just excel in whichever track you choose. Okay, and this is something which you're all aware of, and no politics at all, but somewhere in the past, some 400-500 years in the past, we were the Sone ki Chidiya. Now the onus is on each one of you to get us back to that level. Okay, so we do want that kind of knowledge, that kind of commitment, that kind of excellence from each one of you to take our country back to the heights which we were at 200-300 years back. Okay, so you're familiar with this. 4.5 years of MBBS, 1 year of internship, और उसके बाद क्या होगा? अभी तो आपके पास 3 साल 4 साल हैं, but everybody is faced with that big dilemma that after MBBS what? So today we will try and I'll try and show you some options which you could choose, which you could consider after your undergraduation, after your MBBS. And these are the broad paths, and this question mark, this query, this phase of uncertainty when you finished your MBBS, when you passed your final MBBS exam, this confronts every single medical graduate. And fortunately for you, for us, there were only 2 options. One was to go in for post graduation, and the other was to go into practice. There weren't too many options. For you, there are lots and lots of options, and possibly you should start thinking of those options right now. And if you orient your thinking and your learning towards that goal right now, then it will possibly be of help to you. So what are those options? Just wanted to do this talk and this lecture and broaden your horizon so that you would at least know the options and at least start to think of those options. So remember, success is not the key to happiness. I may be the best practitioner in the whole city of Jaipur. I may be seeing 100 patients a day. I may be earning 10 lakhs of rupees in private practice every month. But that is not the key to happiness. The key to happiness is if you are doing what you like, if you are doing what you love, that is the key to happiness. And these 2 things are many times not in sync. So professional success and happiness, they could be together. That would be the best thing. And sometimes they are divergent and they are not synonymous. So what is the scope, what are the job profiles which a medical graduate can have? You could consider yourself to join somewhere as JRs, junior residents or junior doctors, and help the hospital or the unit or the team or the department in seeing the patients, writing histories, making discharge tickets. We have a whole bunch of junior residents in our hospital, and when you start your clinical rotation, I suggest that you sit down with them, make friends with them, talk to them, and find out the pros and cons of being a JR in a large hospital or being a JR in a small hospital, right? So you could do any one of these things. You could, open your clinic and become a physician, start general practice. Good option. Uh, there are lots and lots of patients who need your help, and the world is shifting towards first contact with a family practitioner or a primary physician. So there is scope still for being open your clinic and being a physician. Then similarly, if you could be a junior surgeon, you could assist in the operation theaters. If you think of a teaching career like what I opted for, then you will have to do a post graduation and then getting into the teaching line, getting into the academic line, becoming an assistant professor, associate professor, and a professor. Then you could also think of moving a little laterally and choosing research as your career option. That is a good option also. And in our country, when I was at your level, there were very few research opportunities, but now there are lots and lots of research opportunities. So that is a good option, being a researcher or being a scientist, to think of. And where can you work? Where are the avenues for you to consider working? It could be a hospital, it could be a laboratory, it could be a biomedical company, nursing home, medical college, health center, or a pharmaceutical or a biotechnology company. So this is the option which most of us choose, which most of us like to choose. And very few of you will, kind of not think of this as the first option. Like, postponing the career decision for 3 more years and just joining post-graduation. Let's do MD or let's do MS. अभी भी 3 साल बाद देखा जाएगा, right? So if you are able to qualify for your entrance exams, then this is the option which the majority of you would choose. We are well aware of that. So you could choose to become choose to enter an MD course or an MS course or a diploma course, and you could choose to specialize in any one of these broad disciplines like internal medicine or general surgery or gynae, pediatrics, ophthalmology, ENT. But you will have to clear the PG exam. And if you don't get into one of these courses, it is not the end of the life. There are lots of other options which we will talk about. Usually the postgraduate course, the MD MS course, is of 3 years. Diploma is about a year less, 2 years. And once you enter the course, then you get a stipend also. This is a paid post. You are considered as a member of the workforce. And one of the main reasons why you would want to do a post graduation is that if you expand your education, then you have the most powerful weapon in your hand. And if you want to change the world, you will need this weapon. So MD medicine, you can have non-clinical branches. You could choose to do a post-graduation in anatomy, physiology, biochemistry, pathology, pharmacology, microbiology, preventive medicine, forensic medicine. Some of them are completely non-clinical branches like anatomy, physiology, biochemistry. But they are very important branches which you will realize in the next few months. They are the foundation courses for every medical student. They are the building blocks by which you make good clinicians or bad clinicians. So if you have a passion for teaching, then these are extremely good options. There are some paraclinical branches in which there is some overlap with the patient, branches like pathology, pharmacology, microbiology, preventive medicine, forensic medicine. You do see some patients, but primarily you work in the lab. And these are also very good branches like pathology, branches like microbiology have massive scopes. You can really make a difference. If you can identify the COVID virus in your laboratory, if you can sequence that COVID virus, then you are helping not only your clinical colleagues, but you're helping the whole humanity. So if you get a post graduation in any one of these branches, it is good. Then if you think of clinical branches, then we have these common clinical branches which everybody considers: medicine, pediatrics, dermatology, psychiatry, chest and tuberculosis, anesthesia, radiodiagnosis, radiotherapy. So all these are hardcore clinical branches. If you think of, yeah, please. So MD pharmacology, primarily in a medical college setup, the MD pharmacology is a teacher, is an academic post. When you get into your next year, then these people are going to teach you pharmacology, and pharmacology is the study of medicines, drugs. How are they discovered? What is their mechanism of action? What are the uses? When are they indicated? What are the side effects? Then pharmacology also has a bigger connotation of drug research. If you become a MD pharmacology, you could choose to go into drug research, drug trials. There are a huge number of pharmaceutical companies which make these medicines, make new medicines. All these medicines have to be tested, tried. So there is a big role of pharmacologists in the industry also. And you are at the cutting edge of drug discovery also. So if you want to you do MD in pharmacology, then you think of research, big scope there also. It is a reasonable scope in India. And most of the multinational companies, they are all present in India. Even they may not be doing trials in India, they may not be having their research facilities in India, but there are enough number of Indian pharmaceutical companies which have major new drugs, major clinical trials, and major research agendas. So that is a reasonable option, good option to consider. Okay? Then if you think of the surgical branches, you have general surgery, orthopedics, obstetrics and gynecology, ENT, ophthalmology. So one more thing which I may want to point out here is that if you choose something like general surgery, then possibly after the 3 years of general surgery, you would need to pick up a specialty. That is the trend now. You may need to specialize in neurosurgery or in gastrosurgery or in liver surgery. But if you choose a relatively focused smaller branch, say like ENT and optho, then that's it. Once you do your MS, then you don't have to do a DM or an MCH. Then maybe you can do a 1-year fellowship in, say, if you have ophthalmology, in cataract surgery or in retina surgery, and then in 3 years of the MS for ophthalmology and 1 year of fellowship, you're done. You are a qualified specialist, and then you can launch yourself into whatever you want to do, either in the academic setting, in a medical college hospital, or in the private setting, in the private practice, or you could join a corporate hospital. So slight difference between the broad specialty and the narrow specialty. Possibly after doing the broad specialty, say MS in general surgery, you may feel the pressure to do super specialization. Then there is another track. Suppose you don't clear and don't get admissions in the hardcore MD, MS postgraduate programs, there is an alternative of doing a diploma from the national board, which is considered as equivalent to a postgraduate degree. Say, for example, it is considered equivalent to an MD or an MS degree. So you have to keep in mind that there are a few problems with the DNB as compared to the MDMS. The pass rate for DNB is significantly less as compared to MDMS. So the exit exam is a lot more difficult. And why is it more difficult? Suppose you're doing MD medicine at Mahatma Gandhi Medical College Hospital. You have a full 3-year period to show your work, show your intelligence, show your commitment to your unit head, your departmental head, your other faculty members. And your examination is going to be held at, the MD examination is going to be held at Mahatma Gandhi Medical College Hospital only. And 2 of your faculty members, maybe your HOD, maybe your unit head, will be your internal examiners. There will be 2 examiners from outside, but you have the insurance and the backup of 2 people who you have shown your work to for 3 years. So that's a big insurance. Suppose on that one particular day when you're doing your exam, you don't do well. You have fever or you get nervous or whatever reason, you get a lousy case and you don't do well. So your internal examiners may be able to convince your external examiners that this boy is good, this girl is good, has shown exceptional intelligence and diligence in the 3 years he or she was with me, and then you have a better chance of clearing the exam. What happens in the DNB? You have an exam at a neutral venue. Suppose you're doing DNB at, we don't have a DNB here. Medical college hospitals usually don't have a DNB. Private hospitals, non-medical college hospitals, they have DNBs. So if you are doing a DNB in, say, Durlabji Hospital in Jaipur, eligible for MD degree, then your exam will be held at a neutral place. Say, for example, it will be held at Safdarjung Hospital in Delhi. Completely alien environment. They will have 6 examiners who are completely foreign to you. And your making the exam or not making the exam will 100% depend on your performance on that day. What you've done for the past 3 years, those guys don't know. You are absolutely new to them. So some insurance is lacking in the DNB course, particularly when you do the exam. If you are good, if you perform well, then there is absolutely no problem. You will clear the exam. But for some reason, you don't perform well on that particular day. Or if the other 9 candidates, suppose 10 candidates are appearing in the exam, you are unlucky enough to get 9 brilliant people in your examination batch, then those 9 might, make the exam and you might not make the exam. So you understand what I'm trying to say. Then there are certain other small problems with getting a DNB degree as compared to getting a MD or MS degree. Some of the hospitals still give theoretical preference to the MD/MS postgraduates as compared to the DNB postgraduates. And thirdly, DNB is usually offered at private hospitals. The emphasis of treatment of the patient at private hospitals is, patient care and revenue. Less emphasis on academics. There are some very good private hospitals. I'm not denying that. I'm not clubbing everything in one batch, but there might be a possibility that there might be less academic inclination as compared to revenue inclination if you're doing your post-graduation from a private hospital. Surgical fields, suppose I am a surgeon at, again, Durlabji Hospital, and if a patient comes to me as a private patient in a private hospital, that patient would want that I do the surgery on that patient. The patient is coming to me because of my name, my fame. I may not be able to give that patient to you to operate and to learn from that patient. So that again is a small issue in DNB as compared to MD. At SMS hospital, I would have the patient is coming to the hospital, patient is not coming to me. I would have no hesitation in asking my lecturer or my third year postgraduate, okay, go do the surgery. I am standing here. If there is a problem, I'll come in. It may not be that clear cut in the private setup. Then once you've done your post-graduation, there is also an option of doing a subspecialty. I'd like to call it super specialty because I'm a medical oncologist. I did my medical oncology training. When I did the training, which was way back in 1990, there were no DM courses, so I did a 2-year training at Tata Hospital. So I prefer to call it super specialty, but you can call it subspecialty also. And there are surgical subspecialties or super specialties like cardiothoracic surgery, oncosurgery, plastic surgery, gastrosurgery, hepatobiliary surgery, neurosurgery, organ transplant, pediatric surgery, urology. You could, after doing your MS in general surgery, opt to do one of these super specialties. And similarly, in the medical fields, you have super specialties in cardiology, gastroenterology, nephrology, neurology, endocrinology, oncology. So all these are available to you post MD. So this is again a competitive exam. This is again a 3-year course, and again a thesis to write, and again an exam to clear your qualification. So if you choose to do your super specialty, then you would be studying for more than a decade. Okay, so if some of you are ready to do that, but then you are the ultimate, you are the top of the pyramid in the sense that there is nobody above you, the buck stops with you. And all of you are aware that there are lots of super specialists now. And my feeling is that by the time you get into the work field, the pendulum, which is very much inclined towards super specialty now, might be moving to the center, and the role of internists or the role of general surgeons, might be more as compared to what it is now. So there is something which is known as the UPSC, and which is something which is known as the Combined Medical Services, something like the IAS and the Revenue, IRS, the central services in which doctors are employed in railways, corporations, and there is a very stiff competitive exam for this, but there is a scope of getting into this, and their salaries are about 1.5 times the salary of anybody else, and you have a secure job. You are entitled to loans, you're entitled to a pension. Sometimes if you go up the ladder, you're entitled to government accommodation. So that again, even after MBBS, is an option. Appearing for the UPSC exams, getting selected, and becoming a CMS doctor. So these are the hardcore medical options. There are some lateral branches also. You could still be involved in medicine, but you could think of taking a path which is parallel to hardcore medicine, and that is if you after your MBBS think of doing a business administration masters. So there is quite a few young people now who are opting for MBA after MBBS, and this again has its own niche and its own place of work, and these people are also quite much in demand. There are several institutions which you could seek admission. Then again, the admission is very competitive, And once you do a MBA from a good place, say for example, if you do an MBA from IIM Ahmedabad, then in the pharmaceutical industry, in the hospital industry like Apollo Hospital chain and Fortis Hospital chain, it's very easy to get employment and high level employment there. Clinical research, we did talk about it a little bit. There are lots of institutions which offer courses and fellowships in clinical research, and this is an important field, an essential field, where you would be in charge of clinical trials. If you are good, then you might be the person designing clinical trials. So this is again an option for you which you should consider. All these slides are going to be there with Dr. Aparna, and anytime you want these slides, you have access to them. And I will also request her to post this on the college website. So if anytime, maybe a year from now or maybe 4 years from now, you can see these, access these, then of course we are always accessible to you. So again, we have so many hospitals coming up now, so many private hospitals, so many government hospitals. Everybody now wants a health management expert to run those hospitals. Say for example, be the medical director of that hospital, be the superintendent of that hospital, and to add to your skills in understanding hospital running and hospital management, you could think of a master in health administration. So if you're good at managing people, then rather than do an MD/MS, you could think of doing a post-graduation in health administration. Some other fields are there, MTech in biomedical engineering and biological sciences. If you are a hardcore researcher, if that is your interest, this is an option for you. The IIT offers these courses. And similarly, Master of Medical Sciences and Technologies again can be done from the IIT if you have a research bent of mind. Then Master of Public Health again is extremely important for the vaccination point of view. If you like preventive and social medicine, then this could be a good forward career path for you. You could get a job in the WHO or the UN. So again, an option to consider after MBBS. Then if you don't want to study anymore, if you think that, okay, these 5.5 years is enough, then you could think of working in the primary health centers and contributing to the health of our rural population. Again, they are a very important cog in managing the health of the state and managing the health of the country. Then you could think of going outside if you have the resources to pay the fees, or if you are brilliant enough to get a full scholarship. You have to do certain exams. If you want to go to the US, there is a different set of exams. If you have to go to the UK, if you want to go to the UK, then there is a different set of exams. And you can think of appearing for these exams, acing these exams. Then if you really are in the top percentile, then you could get to choose your institution. You could get to, they might offer you a full scholarship also. There are fellowships which are offered by several international teaching organizations which you could think of doing. So let's talk about the job sector a little bit. So you could think of, if you think of the medical education department and a job in a medical college, you could in the non-clinical sphere, you could think of demonstrator tutor and then move up into the permanent posts as assistant professor, associate professor and professor. So you could think of junior residency, which I've already talked to you about. This is usually a short-term temporary post and usually a stopgap for the next career decision. Senior resident is somebody who's done his or her post-graduation And again, this is usually a temporary stopgap post till you decide what you want to do next. Do you want to go into a DM program, an MCH program? You want to set up your own clinic? You want to work for the state services? Then you could go into the academic line, teaching faculty, assistant professor, and then gradually move up the ladder to associate professor, head of department. And if you are so inclined, you could move into administration, become the medical superintendent. Similar structure is available in the private medical colleges like our medical college, junior residency, senior residency, and then the teaching stream. You could think of a job in a corporate hospital after MBBS. We're talking about after MBBS. You could think of becoming a duty doctor, emergency duty doctor, junior consultant, and then, if you put in the enough amount of seniority and you add a postgraduate degree to your MBBS, then you could think of moving up the ladder in the patient care system. Then government jobs, we've already talked about central government jobs, state government jobs. Army Medical Corps is another option which you could think of, and I think I have some slides on that. We've already talked about the UPSC. So the UPSC has certain jobs in railways, in factories, in CGHS hospitals, and their pay is quite good, and you have all the securities of a government job. The Army, the Navy, the Air Force, the BSF, the CRPF, they all have vacancies and jobs for medical graduates and also medical postgraduates. So that if you are not inclined to study further, then that is an option, a reasonable option to consider. You are serving the armed forces of your country, and you're contributing to the well-being of the army of our nation. So then you may at the MBBS level also think of doing something of your own, thinking of entrepreneurship. You could open your own clinic, and as I said, there is always going to be an opportunity for a good doctor, a good family physician. And then again, if you are not inclined to study further, not inclined to do a postgraduate degree, you could think of private practice, opening your own clinic. Opening your own nursing home or working in a nursing home at MBBS level is also an option. And again, working in a corporate hospital, and if you have the wherewithal and the mind and the finances, you could jolly well open a hospital also, set up a hospital also, and set up a corporate hospital also. So if you are an entrepreneur, if you have that drive, then there is no limit to what you can think of even after MBBS. Then you could think of opening up a pathology lab, a microbiology lab, and there are so many private labs which are governed by medical graduates and which do really good work and really good service. Similarly, so many imaging centers are there, X-ray centers, sono centers, CT, MRI, PET scan centers, which are run by and opened and supported by medical graduates. Then endoscopy centers can be thought of, minimal invasive procedure centers can be thought of. And if you are an entrepreneur, if you have the entrepreneurship skills, then you could think of investing, opening, running one of these centers and employing experts to work on these, run on these. Medical transcription again is an option. How many of you know what is medical transcription? So what happens is in the Western Hemisphere, where workforce is limited, suppose I am a radiologist, I have to report 5 MRI scans what I do is that I pick up a mic and I record my report. MRI scan of 56-year-old male patient who has come to emergency room with right-sided hemiplegia. The T1 weighted image is showing this, T2 weighted image is so like a one page of dictation, and that dictation is then sent by internet to somebody who types that. And if you understand medical jargon, if you're a medical professional yourself, then you are in demand. So this is medical transcription. You could be sitting in your home with your computer and you could be typing reports from a physician, from a surgeon, from a super specialist, from a radiology expert, and then sending that typed report back. So this is again a career can be made in medical transcription. So you have to have sound knowledge of the medical field. You have to know the vocabularies and the terms, medical terms, and then you can easily become a transcriptor. Apart from this, the whole world is open to you, and when you enter any one of these fields, like as you do a business, open a business, become a politician, become a landlord, you know, the whole works. And the moment you have that prefix in front of your name, Dr. Hemant Malhotra, and opening this restaurant, then it automatically gives you a little bit of weight in the social structure. And you may or may not wish to pursue your MBBS, but you have all these options in addition to, or as a sole occupation, any one of these things you could choose of. I would hate that you do this, because then you're wasting one medical seat and you are wasting the intellect which you have proven yourself to have. But all these options are also open. Okay, so successful and unsuccessful people do not vary greatly in their abilities. They vary in their desire to reach their potential. Okay, so just remember this. जितनी मेहनत करोगे, जितना इनपुट लगाओगे, जितना फोकस्ड एफर्ट करोगे, those many fruits you will bear. So I think this was my last slide, and I wish and hope that there is light in your careers, in your life, and we are available to you 24/7. I already showed you my email in the beginning. I'll show it to you again just now. And if there is anything I can do to help you in your MBBS career, after your MBBS career, during your post-graduation, during your super specialization, you have a friend for life. Okay?